Introduction: hypertension is one of the most prevalent chronic conditions and poses a serious threat to overall health. Persistently elevated blood pressure not only increases the risk of atherosclerosis, heart disease, and stroke, but it also significantly degrades quality of life. Numerous studies have shown that an unhealthy diet, marked by excessive salt, high fat content, and uncontrolled alcohol consumption, is a key contributor to the development and progression of hypertension. Consequently, a scientifically designed dietary intervention is widely recognized as an indispensable element in the prevention and management of high blood pressure. In this article, we will detail which foods should be incorporated into your diet and which ones to avoid, thereby helping you better manage your blood pressure and lead a healthier life. Hypertension and diet: a close relationship. As people age, metabolic functions decline and kidney regulatory capacity diminishes, making blood pressure regulation increasingly challenging. Diets high in salt, saturated fats, and processed foods place an additional burden on the body. Over time, this can lead to water and sodium retention and may eventually cause damage to the vascular endothelium, further accelerating an increase in blood pressure. In addition, poor eating habits disrupt the delicate balance of essential minerals like potassium, calcium, and magnesium, all of which play critical roles in cardiovascular health. By modifying our dietary choices, we not only reduce the risk of hypertension but also enhance overall health. Recommended healthy foods for individuals managing high blood pressure: it is vital to focus on nutrient-dense foods that help maintain water-electrolyte balance and support heart health. The following sections outline some of the best food choices and practical suggestions for an effective dietary regimen. 1. Potassium-rich foods. Potassium plays a vital role in offsetting the effects of sodium by helping to relax blood vessel walls and promote proper fluid balance. Increasing your potassium intake is a proven way to support blood pressure control. Consider incorporating the following. Fresh fruits. Fruits such as bananas, oranges, and kiwis are not only naturally sweet and delicious, but they also provide an excellent source of potassium. These fruits help reduce excess sodium in the body, thus facilitating better blood pressure regulation. Fresh vegetables. Vegetables like potatoes, tomatoes, spinach, and broccoli offer significant mineral resources. Regular consumption of these vegetables ensures an adequate supply of essential minerals, which supports the ionic equilibrium in your body. Case example: Mrs. Johnson. At 68 years old, Mrs. Johnson had long relied on pickled vegetables and frozen prepackaged meals, which resulted in chronically high blood pressure readings. After consulting with her doctor, she restructured her diet to include plenty of fresh fruits and low-fat dairy products while dramatically cutting back on processed pickles. Over a 3-month period, Mrs. Johnson's blood pressure gradually returned to a normal range, and she even noticed a modest reduction in body weight. She remarked that her energy levels improved and her appetite became more balanced. Note: patients with compromised kidney function should adjust their potassium intake under medical supervision. 2. Foods high in calcium and magnesium. Both calcium and magnesium have protective effects on the cardiovascular system. They assist in managing vascular tone and may counteract some of the detrimental impacts of high sodium intake. Low-fat dairy products. Options such as skim milk, low-fat yogurt, and low-fat cheese supply not only calcium but also a bioavailable form of these essential nutrients. They also contribute to healthy cholesterol levels and are beneficial for overall heart health. Legumes and nuts. Foods like soybeans, lentils, almonds, and walnuts provide ample amounts of magnesium, along with healthy fats and proteins. These nutrient-rich foods help maintain steady blood pressure and support a well-functioning cardiovascular system. 3. High-fiber, low-fat whole grains. Whole grains are an excellent source of dietary fiber and essential micronutrients that help stabilize blood sugar and regulate lipid levels. Dietary fiber also enhances satiety, which can aid in weight control, a crucial factor in some forms of hypertension. Examples: brown rice, whole wheat bread, and oatmeal are highly recommended. Including these foods in your daily meals not only boosts overall nutrient intake but also helps you maintain a healthy weight, thereby indirectly reducing the risk of high blood pressure. 4. Lean protein with light cooking methods. Protein is essential for tissue repair and maintaining the health of blood vessels. For those managing hypertension, it is important to choose lean protein sources and prepare them with minimal added fat. Fish and poultry, prioritize white meats and fish such as salmon, skinless chicken breast, and turkey. These foods are low in saturated fat and offer high-quality protein that supports vascular health. Plant-based proteins, tofu, soy milk, and other plant protein sources provide an alternative way to get essential amino acids with less fat. When preparing these proteins, use heart-healthy oils such as olive oil to avoid excessive saturated fat. Case example, Mr. Davis. After retiring, Mr. Davis found that his love for fried foods and fast food had left him with abnormal cholesterol levels and high blood pressure. Under the guidance of a nutritionist, he switched to baking and steaming his meals, increased his consumption of whole grains and lean proteins, and began taking regular walks every day. Over the course of 6 months, Mr. Davis experienced a notable boost in energy, and his blood pressure and lipid profiles improved significantly. Foods to avoid or limit. In addition to knowing what to eat, individuals with hypertension must also be mindful of what to avoid. Reducing or eliminating certain food groups can have a profound impact on managing blood pressure levels. 1. High sodium foods. Excess sodium is a major culprit in water retention and elevated blood pressure. It is crucial to cut back on foods that contribute significantly to sodium overload. Pickled and cured products, items such as pickled vegetables, cured meats, and salted fish typically contain high levels of sodium and can cause sudden fluctuations in blood pressure. Instant noodles and canned foods. Many processed grocery items, especially instant noodles and canned soups, are loaded with salt and preservatives that hinder effective blood pressure control. 2. Foods high in saturated fat and cholesterol. Excess animal fat and cholesterol can exacerbate the development of atherosclerosis, increasing the likelihood of heart disease. Red meat and organ meats, meats like beef, pork, liver, and kidney are not only high in saturated fats but also in cholesterol. Reducing consumption of these foods can ease the strain on your cardiovascular system. Fried foods. Foods such as fried chicken and French fries are typically cooked in oil at high temperatures, resulting in the formation of trans fats. These fats are particularly detrimental to heart health and may contribute to abnormal blood lipid levels. Case example, Ms. Taylor. Ms. Taylor, a busy professional in her early 40s, often relied on takeout and fast food for her meals due to her hectic schedule. Initially, these high-salt, high-fat options led to a spike in her blood pressure. Recognizing the danger, she began preparing her own meals at home. She made a habit of reading food labels carefully and opted for fresh produce and lean proteins. As a result, Ms. Taylor's blood pressure readings gradually stabilized, and she felt a significant improvement in her overall well-being. 3. Processed foods and fast food. Modern convenience foods, including fast food such as burgers, pizzas, and snack items, are notorious for their high levels of additives, sodium, and sugars. These factors contribute to obesity and hypertension by providing excess calories without substantial nutritional benefits. 4. Stimulating beverages. Strong caffeinated beverages and excessive alcohol can trigger temporary spikes in blood pressure and strain the cardiovascular system. Coffee and tea. While moderate consumption of coffee or tea can be part of a healthy diet, drinking them too strong or too frequently may overstimulate the nervous system. Alcohol. Regular overconsumption of alcohol has a direct negative impact on blood pressure and heart health. It is advisable to limit your alcohol intake or avoid it altogether. Practical tips for dietary adjustments. Read food labels carefully. Pay close attention to the sodium content and saturated fat levels listed on food packaging. Avoid items with high levels of additives or hidden salts. Cook at home. By preparing your meals at home, you can control the quality and quantity of ingredients used, ensuring that you adhere to low-salt and low-fat cooking methods. Implement gradual changes. Transitioning to a healthier diet does not happen overnight. Start by reducing your sodium intake by a few grams daily, then gradually adapt to a low-salt, low-fat diet. Consult with professionals regularly. Communicate with your doctor or a registered dietitian to adjust your dietary plan according to your health needs. Personalized advice is key for effective blood pressure management. Adopt a holistic lifestyle approach. In addition to dietary changes, regular exercise, sufficient sleep, and stress management are crucial for effective blood pressure control. A well-rounded lifestyle can significantly enhance the benefits of your dietary efforts. Managing high blood pressure effectively is about more than just taking medications. It's about making informed choices in every aspect of your life, starting with your diet. By choosing foods that are rich in potassium, calcium, and magnesium while limiting salt, saturated fats, and processed ingredients, you can significantly reduce your blood pressure and the risk of heart-related complications. Remember that a healthy diet is a cornerstone of disease prevention and wellness. Taking control of your plate is the first step toward securing a healthier future. We hope that every patient with hypertension recognizes the power of dietary change. By making small yet impactful adjustments to your daily meals, you can set the stage for sustained cardiovascular health. Embrace the guidance provided here, and start your journey toward a vibrant, energetic life, one meal at a time. May every individual with high blood pressure make wise dietary choices, transforming their table into a foundation for lifelong health. Enjoy the benefits of a healthy, balanced diet that not only nurtures your body but also inspires you to live life to the fullest. Important reminder: always consult with a qualified healthcare provider before making significant changes to your diet or taking new supplements. These recommendations are intended as guidance and should be tailored to your personal health condition. Avoid unregulated products and ensure that any changes in your diet are made with professional advice.